Welcome to The Explainer. Today, we're going to follow a single pill on its incredible journey through the human body. Think of it as a microscopic adventure, and we'll use these slides to make its complex path crystal clear.
You know, it seems so simple, right? You just swallow a pill. But the second it leaves your hand, it's kicking off this epic, almost heroic adventure inside your body.
And yeah, there's a super scientific name for this whole process: pharmacokinetics. Sounds complicated, I know, but all it really means is what your body does to a drug. Simple as that.
Okay, so this whole adventure has four main stages. You've got absorption, distribution, metabolism, and excretion. For this explainer, we're really going to zero in on that first, crucial step, absorption. Because honestly, this is where the fate of our little pill hero is pretty much decided. All right, let's get right into it. To make this real, let's meet our hero. A single, 500 milligram paracetamol tablet. Its mission, should it choose to accept it, is to take down a raging fever, and the clock starts ticking the second you swallow it. So, before our hero can even think about getting into the bloodstream, it hits its first two obstacles right there in your gut. First, that solid tablet has to completely break apart, disintegrating into a fine powder. And then that powder has to dissolve, becoming a liquid. Because here's the thing. Your body can't absorb a solid. The medicine has to be fully dissolved to even have a chance.
Okay, so our hero is dissolved and ready for action. Now the real journey can begin. But the path forward, it's like a maze, a total labyrinth. And whether our pill makes it through depends on a few really key factors. So the number one rule of this labyrinth is basically like attracts like. See, most drugs are either slightly acidic or slightly basic. An acidic drug, let's say aspirin, is going to feel right at home in your stomach, which is also acidic. In that environment, it stays fat-soluble, which is perfect for slipping through cell walls. But if that same acidic drug ends up in your intestine, which is more basic, it changes. It becomes water-soluble, which makes it way harder to absorb and way easier for your body to just flush right out.
Okay, so based on that, you'd think the stomach is the best place for acidic drugs, right? Well, here's the twist. It turns out that almost all drug absorption happens in the small intestine, no matter if the drug is acidic or basic. And the reason is simple real estate. Your small intestine, if you spread it all out, has the surface area of a tennis court. It's massive. That just gives our hero so much more space, so many more chances to get absorbed into the bloodstream compared to the tiny little stomach.
And then there's food. Food can be a drug's best friend or its worst enemy. Some medicines, like levothyroxine for your thyroid, need an empty stomach to work properly. Others, like an antifungal called glycylfulvin, actually get absorbed better with a fatty meal. But here's where it gets tricky. Take the antibiotic tetracycline with a glass of milk. The calcium in the milk will literally grab onto the drug and form this big clunky molecule that your body just can't absorb. Boof! The medicine is useless. This is exactly why you've got to read those labels. Take with food or take on an empty stomach isn't just a suggestion.
All right, moving on to the next level of the obstacle course. Your body isn't just sitting there passively letting drugs in. Oh no, it has its own security systems. We're talking gatekeepers and toll booths, all designed to spot foreign chemicals, like our little paracetamol hero, and deal with them.
So the first line of defense is this protein called P-glycoprotein. The best way to think about it is like a bouncer at a nightclub, and the club is your bloodstream. Its whole job is to be an efflux pump, which is just a fancy way of saying it's a one-way door that only pushes things out. It spots foreign stuff, grabs it, and just throws it right back into the intestine to be kicked out of the body. It's an amazing defense system, really, designed to protect you from toxins.
But here's the thing. This bouncer can be distracted or tricked. Some drugs can actually block this pump. And that's where you get some really dangerous drug interactions. For instance, say you're taking a heart medication called digoxin. Normally, the bouncer kicks about half of it out. But if you also take a common antibiotic, clarithromycin, it basically ties up the bouncer. All of a sudden, the entire dose of digoxin sneaks past into the bloodstream. The levels in your blood can literally double, and that can be incredibly toxic.
Okay, so our hero makes it past the bouncer. Phew, but the journey is far from over. Because now, every single drop of blood leaving the gut gets funneled through one special highway, the portal vein, that leads directly to the body's main processing plant, the liver. You can think of the liver as a mandatory toll booth or a customs checkpoint. It takes a look at our hero and immediately starts to metabolize or break down a chunk of it. This is a super important concept called first-pass metabolism or the first-pass effect. All right, let's do the math here for our paracetamol hero. We started with a 500 milligram dose, nice and strong. But how much of that is actually going to make it to the finish line? Well, right off the bat, not all of it even gets absorbed. Between some of it not dissolving perfectly and that bouncer protein kicking some out, we lose about 100 milligrams. So now we're down to 400 milligrams heading to the liver.
And then that liver toll booth takes its share. That first-pass metabolism we talked about, its enzymes just chew up another 100 milligrams. So let's recap. We started with 500 milligrams, and now only 300 are left to actually get into your bloodstream and go fight that fever.
Wow.
This whole process brings us to a really, really important idea in medicine. The percentage of the drug that survives all of that, the gut, the bouncers, the liver's toll booth, and actually makes it into your bloodstream, that's called its bioavailability.
So for our paracetamol hero, starting at 500 and ending with 300 milligrams in the blood, its bioavailability is 60%. Think about that. 40% of the medicine you took was lost before it could even begin to work. And this is exactly why doctors and pharmacists calculate dosages so carefully. They already know some of it's going to get lost along the way.
And this just perfectly shows why the route you take a drug is so important. Think about it. When you get a drug through an IV, it's going straight into your veins. It completely bypasses the whole obstacle course. The stomach, the intestines, the liver's first-pass toll booth, boom. Its bioavailability is 100% instantly. It's the same idea for other routes, like putting a pill under your tongue or inhaling a medicine. They all find clever ways to skip that first pass through the liver, which is why they tend to work so much faster.
Okay, so after all that, what are the big takeaways from our pill's great adventure?
First, remember that absorption isn't just one thing. It's a whole journey, packed with obstacles. The main event really happens in that huge surface area of the small intestine, but that's only after the liver takes its cut through first-pass metabolism. That's the big one. It's why taking a pill is like an obstacle course, while getting an IV is like taking a direct flight. And maybe most importantly, remember that food and other medicines are like travel buddies that can completely help or hinder the journey.
So next time you swallow a pill, maybe you'll think about this incredible journey it's about to take. Because understanding this stuff, it's not just a cool science lesson, it's empowering. It means you're not just blindly following directions, you're an informed partner in your own health. And it really hammers home why how and when you take your medicine makes all the difference in the world.